Welcome to Review Central. This is NCLEX Reviewer number 11, featuring questions on health promotion and maintenance. This reviewer is intended for those who are eyeing, or are set to take, either the NCLEX-PN, or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual passages and questions that appeared on previous NCLEX exams. Let's begin. Question number 1. When assessing growth and development from a cross-cultural perspective, healthcare providers need to be aware of which of the following? A. There may be differences in normal growth curves. B. There may be differences in achievement of developmental milestones. C. There may be differences in the onset of menarche. D. All of the above. The correct answer is D. All of the above. Cross-cultural studies of child development reflect differences in the achievement of growth and development milestones. Factors that may influence these differences include nutrition, preferred activities, and lifestyle differences. Question number 2. A preterm infant, lighter than 2,000 grams at birth, is born to a mother who is hepatitis B surface antigen positive. What is the appropriate management of this patient? A. Hepatitis B vaccine and HBIG, within 12 hours of birth. B. Immunization with 3 vaccine doses at 0, 1, and 6 months chronological age. C. Check anti-HBs and hepatitis B surface antigen at 9 to 15 months of age. D. Administer HBIG and start hepatitis B vaccine at 1 month of age. The correct answer is A. Hepatitis B vaccine and HBIG, within 12 hours of birth. Preterm infants of hepatitis B surface antigen mothers, who are less than 2,000 grams, should receive HBIG and single antigen hepatitis B vaccine within 12 hours of birth. The first dose is not counted as part of the series, so additional doses are given at 1, 2 to 3, and 6 months. After the first dose, multiple antigen vaccines can be used. Question number 3. Normal aging results in all of the following cognitive changes, except A. Impairment of thought processes. B. Brain cell loss. C. Acute illnesses result in temporary impairment of mental function. D. Decreased ability to problem solve. The correct answer is A. Impairment of thought processes is not a normal result of aging. Normal aging can result in loss of brain cells and decreased ability to problem solve. Elderly patients have decreased mental reserves, so acute illness can result in temporary impairment of mental function. Impairment of thought processes is more likely to be caused by something other than aging. Question number 4. What group is the CDC recommending a one-time screen for hepatitis C? A. All patients with diabetes mellitus. B. All intravenous drug users. C. People born between 1945 and 1965. D. People who have tattoos. The correct answer is C. People born between 1945 and 1965. In 2013, the CDC began recommending one-time HCV screening for all patients born between 1945 and 1965, because of the high prevalence of HCV infection among baby boomers. During that time period, there was no universal blood screening program in place, and it is believed that many people were exposed to hepatitis C. Genotypic is useful to predict the response to treatment. In general, patients with genotypes 1 and 4 are treated longer than other genotypes. Once chronic hepatitis is diagnosed, the aim of treatment is to achieve eradication and prevent progression to cirrhosis or liver cancer. Question number 5. Which of the following statements about a prenatal non-stress test is correct? A. It assesses the fetal heart rate during uterine contractions. B. It assesses the fetal heart rate during fetal movement. C. It assesses the strength of Braxton Hicks contractions. D. It assesses the dilation and effacement of the cervix. The correct answer is B. It assesses the fetal heart rate during fetal movement. The prenatal non-stress test is a measure of fetal well-being. An increase of fetal heart rate of 15 beats per minute above the baseline for 15 seconds or more with fetal movement is considered normal. Question number 6. Which condition accounts for most limb amputations in the United States? A. Trauma. B. Cancer. C. Vascular disease. D. Triglyceridemia. The correct answer is C. Vascular disease. Vascular conditions are mainly responsible for limb amputations. Among those living with limb loss, the primary cause is vascular disease, 54%, including diabetes and peripheral arterial disease. Trauma accounts for 45% of limb amputations, while cancer accounts for less than 2%. Approximately 185,000 amputations occur in the United States each year. Question number 7. Which of the following is most helpful to avoid osteoporosis? A. Milk. B. Steak. C. Spinach. D. Apples. The correct answer is A. Milk. Milk helps to meet the USDA recommended daily allowance for calcium intake. Osteoporosis is a reduction in the mass of bone per unit of volume. Vegetables, such as turnips, spinach, and broccoli, are good sources of calcium, but they are not as high in calcium as milk products. Question number 8. What is the best treatment for a child with lack of head control? A. Electric shock. B. Surgery. C. Brace. D. Biofeedback. The correct answer is D. Biofeedback. Biofeedback is the process of gaining greater awareness of many physiological functions of one's own body, by using electronic or other instruments, and with a goal of being able to manipulate the body systems at will. Biofeedback is the best option for the child with a lack of head control. Question number 9. Which of the following is not true of preventative health goals? A. There is decreased morbidity. B. There is focus on wellness. C. Patient accountability is diminished. D. There is decreased mortality. The correct answer is C. It is not true that patient accountability is diminished. Preventative health goals emphasize early detection of illness and disease and morbidity. Focus on wellness is the mainstay of preventative health care. Individual and patient accountability is increased in preventative health care models. Question number 10. Which is not an example of wellness programs offered to increase health and awareness? A. Weight management. B. Holiday cooking classes. C. Smoking cessation. D. Anger management. The correct answer is B. Holiday cooking classes are not an example of wellness programs offered to increase health and awareness. On the other hand, weight management and wellness classes, healthy cooking and nutrition classes, and smoking cessation classes are all examples of programs offered to increase health and awareness. In addition, anger management is an example of a mental health class also offered to increase health and awareness. You have just completed NCLEX Reviewer number 11, which featured questions on health promotion and maintenance. If you wish to watch more NCLEX reviewers on health promotion and maintenance, check out our NCLEX Health Promotion and Maintenance Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button to make sure you get notified whenever we post a new reviewer, or other review materials on this channel. Please like if you find this video useful, and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX, and we look forward to your fulfilling careers as professional and licensed PNs or RNs. Good luck and God bless.